As of today, extra help that lowered health insurance costs for thousands of families officially expired. I'm Leanne Abu Taribush, your Thomasville neighborhood reporter, and I'm checking in with Primary Care of Southwest Georgia to explain what this change means, who will feel it most, and how the clinic is stepping in as more people struggle to afford care. The Affordable Care Act, or ACA, helps families pay for health insurance through subsidies. From 2021, thanks to the Inflation Reduction Act, extra help meant many people paid little or nothing for coverage. But now, those extra savings are gone. That means insurance premiums are going up, affecting many families in Thomas County. Take Amanda McGuire. She works full-time at Sweet Cacao and is a single mom of 4. She hasn't had a medical checkup in more than 10 years because of the cost. Rising insurance prices only make it harder for her to get care.
Absolutely no. It discourages me because in the past when I have looked up to get insurance, I've seen those prices and I said, it's a little bit out of my price range. I'm going to have to wait, thinking that if you waited, that things would look better or look up for you. And now if they're increasing in price, that looks worse for me in a sense of I can't insure myself. I make sure that the children have insurance, but for myself, I don't have any.
Virgil, outreach and enrollment specialist at Primary Care of Southwest Georgia, says he expects to see more and more people in that same boat, especially our middle class.
He said they put off appointments. If they don't have insurance, they don't want to be seen because they're afraid of the cost. And what happens? Well, what happens is chronic conditions escalate. You're going to wind up getting more people that have congestive heart failure, people that have major diabetes issues.
At Primary Care, more than 70% of patients make less than 250% of the federal poverty level. That's about $39,000 for an individual or $87,000 for a family of 4. For these patients, Primary Care of Southwest Georgia can help with sliding scale fees. So some visits cost as little as $25. Even if a patient doesn't qualify for the discount, the average visit still costs only $165 to $175. But the real problem is that many patients need care beyond what primary care provides. While the clinic refers patients to local hospitals and specialist doctors for advanced treatments, those visits aren't covered by the sliding scale program for uninsured or underinsured patients. So costs can still be high, making it even more important to stay on top of primary care and catch the problems early. Virgil tells me open enrollment for ACA here in Georgia ends on January 15th, 2026. But if you're uninsured or underinsured and you want to check your options, Primary Care of Southwest Georgia will host a free enrollment event at the Thomas County Public Library on January 8th from 9 a.m. to 11 a.m. In Thomasville, I'm Leanne Abu Taribush, ABC 27.